Council meeting. I want to remind everyone that this is a meeting of the Behavioral Health and Wellness Advisory Council. This is a public meeting, and as such, it is being recorded. You can ask all participants to please mute your microphones, except when you are speaking. We're going to take roll shortly, and we do just appreciate your present response, and we'll record roll. And if you would, later during an open question and answer opportunity with the mayor, just please indicate your name before asking your question. Thank you. So I'll do roll quickly. Angie Thompson. Here. Judge Dan Eisenstein.
Here.
We know Dan is present. Okay. Dr. Stovall.
Here.
Dr. Webb. Katina Beard. Mary Lyndon Salter.
I'm here.
Dr. Burks. Jameson Norton.
Here. Thank you, Bob.
Sam Sessions.
Here.
Tim Womack.
Here.
Robin Nobling.
Here.
Yahtzee Brunner.
Here.
Judge Shillaway. Judge Sheila Conway.
Here.
And in the room, Dr. Michael. And Mayor.
Well, thank you very much. Goodness, what a treat.
Very false.
Yes.
Mayor, absolutely don't.
Well,
Thank you.
thank you. It's a treat to be here. And thank you. I wanted to recognize Mary Falls from my office, who does so much wonderful work. And Dr. Caldwell, we had an excellent protocol downstairs. I had my temperature taken, and thank you for being such a model here. And thank you, Bob. And thank everybody. It's a pleasure to join you today. If you don't mind, what's the protocol in this? Can I take my glasses just for a moment? I'll just do this and then put it back on. I do want to recognize Co-Chair Angie Thompson and Judge Sheila Calloway there in cyberspace, and Dr. Joseph Webb, CEO of Nashville General. I get to see him tomorrow, I hope, with the facility opening. And it's also a pleasure to be here with the Honorable Dan Eisenstein. I'm grateful to the judge for his pioneering efforts to help people with mental illness and provide jail diversion and treatment programs in Davidson County. And I'd like to thank the Behavioral Health and Wellness Advisory Council for your willingness to serve in this capacity to the mayor's office. Now, prior to the creation of this body, there had not been a metro-wide entity that could both hear from community organizations and identify metro-wide priorities for our office to address. Now, I welcome the advice of the council and the dialogue you provide in establishing these shared priorities. Behavioral health plays a vital role in public health, and in public safety, and in economic productivity. And it's a foundation for healthy individuals and families and for the whole community. Good mental health begins with a robust system of care that is responsive to individual needs at the right place and time. Now, we have seen some challenging times in Nashville. First, the March 3rd tornado, then the coronavirus pandemic, and the lasting mental and emotional toll of racial injustice, including anxiety, depression, and PTSD. Now, these events and the ongoing response to the pandemic have revealed stresses that people have never faced before, including high rates of job and income loss, fear of infection, and fear of isolation. Now, a recent mental health study has revealed that 14% of Americans have accessed mental health services during the pandemic, 14%. And of those surveyed, 58% are concerned about their mental health. So this is becoming a 58% are concerned about their mental health. This is a stressing time, isn't it? Before our recent crisis, Nashville had been facing a mental health problem. 1 in 5 residents have been diagnosed with a depressive disorder at some point. Now that outpaces our peer cities of Austin and of Charlotte. So that's something that we need to be deeply aware of. But Nashville's behavioral health treatment options are growing. The Mental Health Cooperative opened the city's first crisis treatment center, which offers no-cost care 24 hours a day, 7 days a week. And this treatment facility features a dedicated entrance for our police officers to bring in anyone for evaluation and treatment. Now, the Davidson County Sheriff's Office is set to open a similar facility in July. And the 60-bed behavioral care center will house individuals who are arrested, but really require a therapeutic environment. Now, additionally, St. Thomas Health is building a behavioral health hospital in Metro Center, slated to open later this year. But the continuum of care and those we must serve is expansive and ever evolving, including a growing need for telehealth services in the age of coronavirus. Now, this council is addressing all these complex challenges in a deeply challenging time, and I'm grateful for your work, and I look forward to collaborate with you towards solutions that improve the mental health and well-being of Davidson County residents. And thank you all. I'm grateful to be here, and I look forward to answer your question and answers. If you don't mind, before we start on questions and answers, it's very rude of me. I'm going to just check my phone for a moment. There are always events in Nashville that you just want to check in on. I don't know, just saying, yes. Okay, super great. Thank you.
Well, again, Mayor, with our gratitude to have you here tonight. And I also want to thank our council members. We sent out a pulse survey. Dia, again, thank you for your work on that. To really give you an updated sense of a number of things, right? I mean, first and foremost, what your council really senses are the community needs at this moment, and how the coronavirus, how the tornado, how the coronavirus, how what we're experiencing today, all about today in Davidson County, is impacting the lives of your constituents. The lives of our neighbors in our community. Some really important information emerged from that. We hope it's helpful to you. We know our primary purpose and role here is to make sure that everything we do is complementing your vision and your goal. Your vision and your goals.
Our vision and our goal.
Our vision, our goal is for a healthy, safe, right, and mentally fit, a well Nashville. We're always looking to make sure that there's alignment there in our shared goals, and they are shared goals. So we hope that information is helpful to you. The work has gone on now for this council for a couple of years, and we're making sure that those priorities are first and foremost. That we bring those to your attention. We also want to make sure today is a bit of an opportunity for members here of the council to, if you have a few more minutes, to direct some questions to you.
Please do. And again, I'm grateful. I think the recognition with COVID is mental health is taking a great stage in concern. And I hope at the other end of COVID, we're a better city, a better country. And one of the betters will be to recognize the role that mental health has in all of our lives and to acknowledge it and to deal with it. And 58%. If you're having 58% of the population that feel challenged in that regard, it becomes such an important subject, and one that we've not always addressed as foremost. I think we have to think of it now as a foremost problem.
As advocates and providers, we also recognize that as a nation, as a state, as a county, as we're starting to watch, right, numbers change. The positive cases identified, the behavioral health numbers change. We also know, given our experience, given the work that's gone on for decades before us, we expect to see a further increase in the need for behavioral health care. And we understand that at so many levels, that physiological level, the psychological level. So many of us today are in a state of stress, and that prolonged stress leads to duress. And the duress soon, that's really going to show all of us what that future and continued demand will be on the system. And again, we want to make sure that we as a community, that we as your council have that system identified, so that those gaps in care are in your full sight, so that as a council, we can be responsive to community needs. So,
Well, if I can, I just want to go over one of your gaps in care. Gaps in care. Right. And if you don't mind, I think it's important work for this council to identify those gaps and help us fill them and know where to fill them and how that works.
Good. Well, can we open the floor then? And as the council members, if you'd just like to, Judge Callaway?
Hey, Mayor, how are you? Just a little busy, huh?
I can't hear you.
Uh-oh.
Let's see.
Can you hear me now?
Well, telehealth, it's not that easy.
we are learning a
Not
lot.
that
We
easy.
are learning a lot.
I'm just gonna call into the meeting here on the phone.
Okay, certainly.
Can you hear me now?
You know, I think interestingly, with a lot of our shared experiences, although we've been doing telehealth for a couple of decades, there's really not been a provider system providing telehealth to the extent that we are. And that surge in providing telehealth has taught us, right, lessons that weren't as transparent before when the service was at such a lower level,
Well,
which has been really helpful, really informative.
and the need for seniors with telehealth is really going to grow dramatically, particularly in this time. Oh, thank you, Mary.
I think one of the other pieces is that we've seen that in the behavioral health realm, when people have the phones, the free phones, the government phones, they run out of minutes. And so, you know, they can't stay on the phone long enough, they can't get what they need, kind of thing. So, I mean, that might be an area to explore further in terms of, are there ways, I mean, they've expanded other services just for the COVID period. Maybe if there's some way, I mean, probably this state level, maybe option, but, you know, any influence that you could use to try to get that, because that's affecting our school kids and our seniors as well, I think. So,
Well, and seniors are going to need to be a protected class for a period of time, for sure. And they're still going to need services and training. And I think that's important. I hope it's also part of the state response to this, to help create a platform in a society that is understanding of the digital divide. And that's not just income, that can be age too.
right, exactly. Yeah, absolutely.
This is Robin. Could I speak up?
Certainly, Robin.
This is Robin Nobling. I'm the executive director of NAMI of Davidson County. And what we've been seeing an increase, in the beginning, we saw people with anxiety and depression. We have a weekday helpline. It's not a crisis line. It is a helpline of information referral for mental health. And so anxiety and depression at first. Now what we're seeing is definitely more psychosis as people have been in their homes. And we're hearing from the family members of these individuals because they're not well enough to contact us themselves. And what I wanted to say about that was we've been fairly successful in sending them to either the crisis center that the mental health cooperative runs or encouraging them to get to a nearest ER. Haven't had to have too much police intervention, which has been good. But I think what we are preparing for is, in addition to the psychosis that we're seeing, we know that we've got a lot of PTSD coming, and because that does not show up right away. And I just want to be able to make sure that the crisis center, and I'm speaking on behalf of Pam here without her asking me to, we need to make sure that that is funded and we have the personnel in place to meet that demand, because we know we're going to be seeing more of it.
Okay. Well, thank you for sharing that with me. Psychosis is a hard word to hear. But you know, we've never had these extreme events. We've got no practice at a pandemic. And I think we need to just be factual in what we see, and maybe we're going to be able to help handle it better.
This is Pam. Can you hear me? This is Pam.
Yes.
I am the CEO of the Mental Health Cooperative, and I didn't put Robin up to that. But one of the things, I think telehealth is great. It's great for people, like Angie said, that have phones. It's not good for the street people. It's not good for people who have psychosis and really need that personal touch. And we have found, we serve over 13,000 people with serious mental illness in this area. And we have a care management system that goes out and helps people get to where they need to go. It's the personal touch. It's all about the relationship. And we have actual statistics now with the telehealth that we've seen a rise in inpatient use. We've seen a rise in emergency room presentations because they need the personal touch. So I just want to caution you that telehealth is great for a portion of people with mental illness, but people with severe mental illness, with psychosis, work as well. And we've got statistics. I always knew my model worked, but I never knew that I had that kind of data. And when we've pulled the care managers back from seeing them face to face, we've seen a big spike in going over across the street to our own crisis center. We've seen a spike in. We've seen a spike in police bringing people in, and we've seen a spike in people hitting the emergency room. So I just wanted to caution this group that telehealth is wonderful, but it doesn't solve the issue that Robin was talking about, people with really severe psychosis that we are on our streets today.
So this is Katina Beard with the CEO with Matthew Walker Comprehensive Health Center. And I just want to piggyback on what Pam is saying in that we don't deal with the very difficult mental health issues as she does. We are trying to get people to enter the system, to come into care. And telehealth is not an entry point for people. It is a continuation of a system that they've entered into. And so telehealth is fine for people who are a part of a system. But as we continue to go through the issues of these times, we want people to engage with the system. And you cannot engage individuals who are suffering from even depression and anxiety as telehealth as the first step. And so we still see our patients face-to-face, in person, in the clinic, because building that trust factor and getting them to engage with the system helps with their medication management, continues with their community support systems. And so we are not an advocate of initial telehealth, but as a continuation of the system.
Well, and this is Mary Linda Salter with TADIS. Let me echo some of these same sentiments and say that as in terms of the addiction provider field, we've had some long discussions about this amongst TADIS members. And while a lot of people were afraid to enter residential treatment, for example, because of COVID issues, and certainly there were some bridge programs established that were more telehealth based. What we're seeing is an increase in relapse rates and an increase in anxiety and depression, even in that population with addictions, because it really was a Band-Aid, for people who needed residential treatment. And whatever resilience that people have to be able to kind of get them through a crisis, it's wearing off, at this point. And the level of care and the level of support that they needed couldn't be provided necessarily, when they needed it. And now they need to be able to get back to a level of care that is truly supportive for the treatment needs that they have. Telehealth is great for people who can and are appropriate for outpatient treatment. But I think in the addiction field, we've seen far too many people in telehealth services that really needed residential treatment.
All right, I guess I'll try. Can you hear me now?
Great.
Awesome. So it said, welcome, Mayor. It's great to see you. I know you've been very busy. For me, of course, it's all about the youth. And, our youth are experiencing trauma like never before. Unfortunately, our youth crime is down significantly. The arrests are down over 40% since March. Our numbers in detention are the lowest they've been in the past 2 years. And so that is a positive thing that's come out of the pandemic. And I definitely want to stress that. My concerns, of course, Prior to COVID, there was not a lot of behavioral health services for our youth. And after COVID, if and what school looks like when they go back, we're going to have all hands on deck to just deal with the trauma that they've dealt with. I know Dr. Battle is working with the health department and trying to figure out how we can do that and how it's going to look for them in the fall. But we've got to make sure that we're giving them all the support and resources that they need when they transition back, that we're not looking to punish, not looking to discipline children when we first go into the school system, but really looking at least, a moratorium on expulsion and suspensions for the first, month or so when they go back, so that we can help them transition through the trauma.
If I may, this is Shotzi. I'd like to speak up. Can you hear me? One of the things I'm proudest of in our city is how much wonderful work is going on. No matter, and we've just had a banquet of different services that are being offered. My role, I hope, can be to be the person who has been in the black hole, who has crawled out of it, and who wants to get to the people who don't know what they don't know. And by that, I simply mean, I want to get into law offices. I want to get to primary care physicians who may be very good doctors physically, but don't connect the dots with what's going on mentally. And so I'm interested in forming some way, an ongoing channel, and hopefully an interested audience of having me come in for lunch and learns or after whatever. But if I get the invitation, it fulfills my obligation to the foundation that sponsors me, which is to educate, to tell people what they may not realize. And of course, that also gets us to the corporate level, which is where I want to get to the C-suite folks who don't understand that just having an EAP program doesn't mean that they've covered this. So all of that is simply to say, in any way I can get invitations from each and every one of you, from the city, wherever, whenever. I want to be able, yes, to tell a bit of my story, but to talk about the importance of when you do step up to the plate and get help, and get good help, which we offer. It makes all the difference in the world. You can live an interesting and interested life with lifelong mental illness, and I'm here to prove it. So thank you.
Thank you.
This is Robin. Could I add to that? Would that be possible?
Please.
Yeah. So, and I'm going to invite Shotzi to join us. We do something called Stigma-Free Companies. It's a national program for NAMI. We've done it locally with Ernst & Young, AT&T, the FDIC. We're an organization of lived experience with families and people with mental health issues. And so we have something where we go out, we do work with EAP, and we have something that is developed for both the employees and the supervisors, helping them. In fact, Advanced Financial just reached out to me for an extension of what we had done with them today with their corporate offices. So, there are things that I think a lot of us are doing that maybe we could be doing jointly for more impact. But this city is kind of amazing. And if you look around, there are things here being done at different levels, and not just by the people here at the table. There's a lot of resources in this city that we could put to bear and we're going to need to. We truly are going to need to. Places like Oasis and, Metro Action Commission can be used and infiltrating in that way. So just want to say, we have resources. It's just a matter of let's stop looking at what we always look at. Let's put a little more effort into that. We're very collaborative and work with a lot of people in this room. All of you are, but there's more than just us. And so let's make sure we're making use of that.
Thank you.
Nothing would make me happier, Robin. Thank you.
Jeffrey or Dr. Sobel, did you unmute? Oh, you're muted. I thought you wanted to. Okay.
Can y'all hear me okay?
Yes, we can.
Yeah, and I think what's being revealed here is that there's a whole portion of the community that has pre-existing psychiatric illnesses, substance use disorders, who are being disengaged from services that have kept them going. And I think we all know that there are just waves of individuals in need and families in need that are coming toward us. And then on top of that, you have individuals who are just worn out by what's been going on, and they're going to be coming toward us. And yes, the resources, and we try hard and we're collaborative. But I would argue that they're just not going to be enough resources. There aren't enough resources. There weren't enough resources a year ago. And I don't know what we can do to build resources for a week from now and a month from now, because these waves are coming. And I'm not sure how we're going to meet those needs. Maybe we can have a discussion that would push us in that direction at some point.
Yes, this is it okay for me to speak now?
Yes.
Yes.
This is Pamela Sessions. I'm the CEO of Renewal House, and we provide specialized addiction treatment for women and their children. And I just want to piggyback on something that's already been stated. When the COVID-19 began, things sort of slowed down at Renewal House. And so now we have been working through this for a couple of months now. We are already beginning to see people just sort of showing up on our campus. We've had a significant increase in phone calls, and we already have a waiting list. So I already know that beyond that, we're going to have a capacity of folks that we really cannot handle. And I think the concern that I have is when people want addiction treatment and they say that they're ready now. And I mean, I know we're going to have to look at all the resources that are available in the community, but I would say in the last week or so, we have just gotten an abundance of calls that we didn't anticipate and just not like anything before. And I think there are people who do have just a tremendous amount of anxiety right now and are in need of help.
Angie,
Yes.
can you hear me? Because I know this is Dan.
Yes, Judge Eisenhunt.
Mayor, thank you for those kind words, undeserved, but thank you so much. And I want to thank you for the work you've done since you've been mayor, particularly with everything that's come along. I've heard from all my friends that I can see and hear from, mostly in events like this, that you need to know that, and I think you do by the statistics and the polls, that I think most Nashvillians, a great majority, appreciate what you've done under difficult circumstances. What I see going forward is what we all see, and that is an economy that is in shambles for a while, which means that money for services are going to be difficult to come by. And my question to the mayor, if he knows, is what is the federal response in regard to mental health? Or maybe Bob knows, or Angie, you know, or somebody else. I've heard a little bit through my work with Mental Health America, but do we see money coming from the federal government to help us at all during this period after we get out of this pandemic?
Well, Judge, if you can hear me back, thank you for your question. It's exactly the right question. And I think that's the importance of this council very much, is that a lot of the federal response is routed through the states, a little bit to larger cities, but most of it, a lot of it is routed through the states. And it is unformed yet, some of where that money goes. There are various buckets, but I think there's an opportunity for groups such as this to help make the claim for federal dollars that either come directly from the federal government or from the states. The state of Tennessee actually is getting $5 billion from the CARES Act. There are buckets. There's one big bucket, $2.3 billion, which is actually at the Commissioner of Finance. It's routed through that. There is a committee that Governor Lee has formed, and there's a time-sensitive nature of this. The money has to be spent by December the 30th. It has to be in a COVID-related response, which of course can include quite a lot of things such as the mental health response. And it cannot replace anything that's in a city or state budget already. So it's the marginal money that's related to COVID. Good ideas on how to help the population, I believe, will be welcomed. They need to be thought through, cost effective, and addressing the real needs of COVID. So I think this is an incredible opportunity for this group to begin to identify those needs. I think we all acknowledge the gigantic, I mean, this is the first time through this pandemic, right? Any pandemic. The huge mental health challenge that it provides, but nobody really has a group about an idea about what's exactly effective. So I'm really here today to help solicit you to come up with good ideas. And then we will, you and I will help advocate for that. I mean, obviously, I have viewed that with the city money, part of the bucket, there are four great challenges. One is mental health and public health, response to the disease. You have to have an economic restart to get us going back again. You've got to deal with education and distance learning. You have to deal with the digital divide, also with seniors. And then you also have to try to repair our social safety net. And there's the chance that you're going to have unemployment for an extended period of time as the economy comes back, works a little bit differently. Each of those buckets, there is a deep challenge, but mental health shows up very much in two of those buckets and how to serve in those two buckets. Again, legislators, mayors don't know that much about what to do, so it needs advice. It needs advice from everybody on this call about how to effectively deploy money to help people who many are isolated by themselves at home and having trouble. How do you reach out to them, and how do you help them? So with that, Judge, again, thank you, and thank you for your pioneering work in our community. I'm going to have to go on and look in on some other events going on in Nashville right now. But if you would, all of you, pool together your best ideas. Mary Falls in our office has been outstanding in trying to be a conduit and a liaison for health. Dr. Caldwell here, who I feel like I see almost every day. But have good ideas for this, and this is my challenge for you. So with that, thank you. Thank you, Bob, very much, and Angie and Dia. I'm going to have to go on, but it is super exciting because we need good advice right now. Right now.
Thank you so
Super.
much.
Thank you. Appreciate it. Thank you, Bob. Thank you. Thank you all.
Thank you.
Thank you, Doctor. Great.
thank you for the conversation to our council members. Really appreciate the questions. Angie, we have a little business.
Yeah, we need to, at this point, I think one of the things we need to do is, after the meeting, we can begin to talk about how we pull together to actually get these recommendations to the mayor.
Right.
So I think that's going to be our charge, obviously. It's time sensitive, so we're going to need to really mobilize around that. Since we can't do that right at this very minute, but the next thing that we do have to do on our agenda tonight is to approve the minutes from the February 6th meeting. So I'll entertain a motion to approve the minutes as presented.
I'll make that motion. This is Robin.
Thank you, Robin. And may I have a second, please?
This Sheila, I'll second.
Thank you. Okay, and because we are on a call, we do need to roll call this with a yes, a no, or an abstain. So if we could go through the list here. So
I did. Yeah.
Okay. Okay. So, Mr. Bureau. Judge Eisenstein?
Yes.
Dr. Stovall?
Yes.
Ms. Beard?
I'll abstain because I wasn't at that meeting.
Okay, thank you. Ms. Salter?
Yes.
I believe Dr. Burks is on. Mr. Norton?
Yes.
Ms. Sessions?
Yes.
Ms. Womack?
Yes.
Ms. Nobling?
Yes.
I must abstain. I wasn't at that meeting.
Okay, thank you. And Judge Callaway?
Yes.
Very good. Okay, excellent. So that wraps up our meeting for tonight. Again, watch for information coming from Bob and myself in terms of how we mobilize to this next challenge. And thank you all for being a part of this tonight.
Yeah, we're going to look for a quick opportunity to reconvene. And again, we'll debrief after this evening's council meeting, get something to you very quickly. So again, always thank you for your time. And again, thank you for everything you did to prep for tonight's meeting with the mayor. Again, thank you. It was really helpful, obviously, to put information about each of your respective organizations and yourselves in front of the mayor. I think it gave him a nice framework from which to approach tonight's meeting. Always helpful. And again, thank you.
Good.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.